The following segment is sponsored by Citrin Cardiology. When it comes to heart health, it's important to be informed. Thankfully, we have Dr. Ben Citrin with Citrin Cardiology in Providence Medical Park here to talk about heartbeats and rhythms. So to start off, what is atrial fibrillation, Dr. Citrin?
Atrial fibrillation is an irregular rhythm of the heart. Ordinarily, the heart beats in synchrony, the upper chambers and the lower chambers. In atrial fibrillation, they're out of synchrony, they beat irregularly, and that can cause some problems.
So why is it important to know if you have this condition?
One reason is that it makes people feel bad. They can be lightheaded, dizzy, have fatigue, they can't get along with their daily activities. And the other reason is that this rhythm in particular, atrial fibrillation, where the heart beats irregularly, can lead to strokes.
So what should an individual do if they're concerned that they have an irregular heartbeat?
Well, the one thing I like to tell people, my patients, is something as simple as every day checking your pulse when you get up. Right below your thumb, you can feel your pulse, and just making sure that it feels regular every morning. And I tell patients when they get up in the morning just to check their pulse as they're brushing their teeth and make sure it feels regular and not irregular.
How is atrial fibrillation diagnosed?
The simplest way is with what we call an EKG, just a basic heart tracing we place on the chest, and we see if the heart rhythm is normal or not. And if there's other suspicion, we can either give a 24-hour monitor, sometimes a monitor somebody can have for 30 days, and then sometimes we can even implant a monitor that can be implanted for up to 2 or 3 years.
So let's say we identify with atrial fibrillation, then what?
Then one goal is to do our best to keep the heart fairly well controlled. We use different kinds of medications for that. Another goal is to prevent strokes, and we use different kinds of blood thinners. One that people are familiar with is one called Coumadin. Then there's some newer ones called Eliquis and Xarelto and others like that that we use to prevent strokes. And then if the individual is still having issues, we sometimes will do what's called a cardioversion, where we actually put electricity to the chest and shock the heart back into normal rhythm. Or some of my colleagues can do what are called ablations, where they actually find the short in the heart, which cause the atrial fibrillation, and treat that.
Thank you so much for your insight, Dr. Citrin. And if you have questions about AFib or any other heart healthy questions, then make an appointment with Dr. Citrin today.